Kia ora, I'm Kevin Hague and I'm the Green Party's health spokesperson. I had two questions in the House this week. What I was trying to do with my questions was to expose the fact that the government is working towards greater private provision of healthcare in New Zealand, and they're doing that not on the basis of any kind of evidence, but rather on the basis purely of ideology. On Tuesday I was focusing on the fact that even though Ryall has talked up consultation with doctors and involving them in decisions, what he's actually done in this case is to cut doctors pretty well out of the equation completely.
My question is to the Minister of Health and asks, does he stand by his support for In Good Hands, the report which outlines the importance of clinical leadership in health decision making?
The Honourable Tony Ryall, Mr Speaker, kia ora koutou. Yes, I commissioned In Good Hands report as part of the new government's drive to engage doctors and nurses in the running of the New Zealand Public Health Service.
Kevin Hague. Supplementary. Why then has the Minister removed the previously agreed requirement for DHBs to consult with health professionals before making decisions to contract out services to the private sector?
The Honourable Tony Ryall, Mr Speaker, under the National Government, district health boards don't need a protocol to have to talk to their staff. We expect them to be working closely with their clinical teams to share problems and solutions, and that direction underpins all arrangements in the public health service.
On Wednesday I shifted the point of attack to looking at the way that our operating theatres are currently used.
How many operating theatres in publicly owned New Zealand hospitals worked at full capacity in the 2007 to 2008 year?
The Honourable Jonathan Coleman.
Mr Speaker, on behalf of the Minister of Health, the definition of full capacity is a complex matter. However, there has been significant modelling done to assess operating theatre utilisation rates. While the work is ongoing, it is fair to say it shows in general that city-based theatres are approaching optimal utilisation rates, while many rural operating theatres are not.
The Minister, when he made the decision about privatising the delivery of this surgery, didn't know how well our current public hospital operating theatres were used. We had an analysis from the Ministry of Health that showed in 10 out of 26 of our public hospitals, the operating theatres were used at only a bit over half of their capacity, and in only 4 of the 26 were operating theatres being used to full capacity. In other words, there was plenty of extra capacity in our existing public hospital operating theatres to do more surgery.
Is the Minister aware that the Ministry of Health has assessed operating theatre utilisation in New Zealand public hospitals and found that 10 out of 26 have been used at less than 60% capacity, while just 4 have been used at full capacity?
The Honourable Jonathan Coleman.
Mr Speaker, well, the member is right in that we do need greater productivity from existing theatres, and indeed the new government sought advice from the Ministry regarding the need for new operating theatres. But even assuming that, New Zealand would still need around 20 to 26 more theatres over the next 18 years to meet a huge rise in elective surgery need because of population growth, population ageing, and a large amount of unmet elective need.
Doing things because they're popular worked fine for National and opposition, but that's no basis for government. That's no basis for making the kinds of decisions that Tony Ryall now has to make. He needs instead to go back to the evidence and actually back to sound decision-making principles.